evening. You're watching the India Development Debate. I'm Tamanna Inamdar speaking to you on a day that Prime Minister Narendra Modi has given his first address on the issue of the coronavirus pandemic and a few important points that came out of his message. Don't think that you are invincible, that you will stay healthy and it will not affect you. Just because our numbers are relatively low right now doesn't mean we can take it easy, and isolation and social distancing is not just a matter of choice, it is something that is imperative at this point. That was the big broad message from the Prime Minister, who talked about a Janta Curfew to be put in place this Sunday, the 22nd March, as a sort of precursor for things to come. Let's listen in.
जनता कर्फ्यू यानी जनता के लिए, जनता द्वारा खुद पर लगाया गया कर्फ्यू। इस रविवार यानी 2 दिन के बाद 22 मार्च रविवार को सुबह 7 बजे से रात 9 बजे तक सभी देशवासियों को जनता कर्फ्यू का पालन करना है। इस जनता कर्फ्यू के दरमियान कोई भी नागरिक घरों से बाहर न निकले, न सड़क पे जाए, न मोहल्ले में या सोसाइटी में इकट्ठे हो, अपने घरों में ही रहे। हां, जो आवश्यक सेवाओं से जुड़े हुए हैं उनको तो जाना ही पड़ेगा, क्योंकि उनका बहुत बड़ा दायित्व होता है। लेकिन एक नागरिक के नाते न हम जाए और हम देखने के लिए भी न जाएं। साथियों, 22 मार्च को हमारा ये प्रयास हमारे आत्मसंयम, देश हित में कर्तव्य पालन के संकल्प का एक मजबूत प्रतीक होगा। 22 मार्च को जनता कर्फ्यू की सफलता, इसके अनुभव हमें आने वाली चुनौतियों के लिए भी तैयार करेंगे।
So the clear messaging there that social distancing and isolation techniques is the primary weapon in India's arsenal while fighting COVID-19. Another important point the Prime Minister made was of an economic task force which will be put in place to look at the outcomes of this social distancing and isolation and what it does to various businesses. The pandemic will have an economic impact as well, and we'll talk about that later too. But first, let's talk about these measures and how far social distancing will go to ensure we don't go to level 3. I have with me today Viren Chetty, ED and Group CEO of Narayana Health, Maithili Bhusrimath, Consulting Editor, ET Now, Arun Maira, former Chairman BCG India, joins me on the show this evening as well. Manish Sabarwal, of course, of Team Lease, and Dr. Sanjeev Badwar of Kokilaben Dhirubhai Ambani Hospital on the show. Welcome to all of you, and thank you so much for speaking with us today. Dr. Badwar, let me come to you really for your assessment on to what extent will social distancing help, because this is based on the understanding right now that community spread of COVID-19 has not taken place up till now in India. ICMR time and again says they have done randomized testing, so community spread has not been found according to them, which essentially means that unless you have traveled from abroad or been close to someone who already has tested positive, you are not likely to have COVID-19, and that would help us if that's the case because it limits the numbers. But do you think that that assessment is completely correct?
Yes, this is a correct assessment. Our entire endeavor right now is to limit spread. And the best way to do that is social distancing and protecting our very young and very old. But you see, this calls for an enormous amount of self-discipline. That's why, as a trial, our Honorable Prime Minister has suggested the concept of a Janta Curfew. We in the healthcare sector are really finding it difficult to tell our patients to put your nation first, put your community first, and take care and avoid contact, avoid going out, visiting hospitals unnecessarily. But it needs to be seen how these measures take place and how effective they are. So this is the way to go, and this is a precursor of things to come. Let's see if the Sunday curfew works out, and maybe there would be more to come. But currently, at this stage, this is the way to go.
Okay, Viren Shetty is also with us, and Viren, we have spoken extensively on the show earlier as well about whether social distancing and isolation really is India's only hope, because we know that the healthcare sector on its own is not going to be able to deal with large numbers if we get there. Do you think that isolation at this point can actually prevent us going to the next stage, which other countries have seen, where suddenly there is, a large number of cases?
Yeah, I don't think isolation is going to prevent us from entering the next stage. But what everyone, health experts, policy experts, people in the medical field have been saying is that this will flatten the curve. This will prevent a surge of patients overwhelming our facilities. It's very likely the coronavirus is among us. It is within the Indian population. It is only a matter of time before it spreads to a large number of people. But if we implement methods like social distancing and staying away from crowded areas, not too many people can get sick at a single time, and what that will do is it will allow our hospitals to be able to deal with the patients one by one rather than hundreds or thousands at a time.
Should we also look at really to what extent the economic task force will have to come in? And clearly there is no a great debate or argument about social distancing. It's a must right now. Implementing it is not going to be easy. Citizens have to come together, and the Prime Minister has spoken that about that as well. But Manish Sabharwal, I want to come to a very important perspective of what the economic task force needs to do and what will be on its agenda right now. Clearly, we've seen countries around the world first extend support to small businesses to make sure that jobs are not lost on a large basis, that those who earn their wages daily do not take a hit. Do you think that that needs to be the prime focus right now, because we can't afford a further consumption drop, which could be an outcome of this social distancing or this Janta Curfew if it's extended over time?
Oh, I don't think we should be under any illusions at all. Everything that we do to get the virus under control is really painful for the economy, and that's fine. We don't live in an economy, we live in a society. So there will be second order effects on the economy and third order effects on financial markets. So I think the economic task force is the right direction of travel. I don't think we should be too prescriptive on whether fiscal, monetary, direct benefit transfer, interest rate cuts, regulatory forbearance. I think the most important input into a GPS is not where you're going, it's where you are. And I don't think we know where we are. Is this isolation going to stay for 3 weeks? Is it going to stay for 3 days? Is it going to stay for 3 months? So rather than sort of preempting everything, and I know people sort of are saying, well, it's better a stitch in time. I heard somebody on the show before saying it's better. But you also have to time these things. I think everybody knows the list of ingredients, but there is a difference between a recipe and list of ingredients. It's about proportioning, it's about sequencing, and the central bank and this task force and the government needs to make sure that we're not sort of shooting in the dark, and if this stays on for 3 months, the measures you take will be different from what if it takes 6 months or it takes 6 weeks. So I would say let's be a little careful and a little more humble in saying that we are in uncharted territory. It's unmodelable. But the list of ingredients is obvious. It could be, UPI reached 1 billion transactions a month. We could do 1 billion transactions a day if we chose to give direct benefit transfer. We have the infrastructure and the plumbing. We could cut interest rates, but I'm not sure the US cutting interest rates by 100 basis points in 2 days panicked the markets or stabilized the markets. The jury is still out there. So I would say the economic task force, what it can do is quite clear, but how it should do it, when it should do it, what should be the sequencing, let's let's not be too prescriptive and be a little more humble in our prescriptions, is my request for both the central bank and the Ministry of Finance and this task force.
Mr. Sabharwal, as far as the informal sector goes, and really that's the one to watch for India, isn't it? Because we've seen whenever there has been any kind of a disruption, it's the informal sector, which is a bulk really of our economy, which takes the hit. The question is, how do you support that informal sector from really taking a major hit at this point? Especially as far as jobs are concerned, as far as wages are concerned. We heard the Prime Minister saying that businesses be kind and people should extend and not cut salaries, etc., till as much as possible. But that's going to be easier said than done, isn't it?
Yes, I mean, though the contradiction might be that India's informal sector is India's shock absorber, right? I mean, the informal sector, people are not self-employed, they're self-exploiting. So I would be careful in sort of positioning the informal sector as either a spring on the way up or a shock absorber in the way down. We're not talking about jobs here because anyway 50% of our labor force only produces 15% of our GDP, the people employed in farms. So I think India's labor market is a little different from advanced country labor markets where they have to worry about unemployment. In India, unemployment is the wrong number. It's poverty and underemployment. And yes, so I think direct benefit transfer will be one option here. Forbearance around loan repayments may be another option here. Lower interest rates may be another option here. But I think there is a large toolbox in India. Lower oil prices do give us some fiscal space, do give us some macroeconomic room. But I do think that I would urge people panicking right now that, triage and emergency medicine, as Dr. Padwar will tell us, is, you don't tell a patient to lose weight or quit smoking when they're in the emergency room. But the Indian economy, we don't know how long this is going to last. So let's just watch the situation, decide where we are, and then we have 10 things we can do. We can easily roll them out in a few hours, forget about a few days.
Arun Myra, do you agree with that prescription that Mr. Sabharwal is talking about, that let's wait and watch, that all of this clamor of announcing packages right away, and we have seen all sorts of associations and industries wanting relief from the government, whether it's retailers, there's talk of a package for the aviation sector, whether it's tourism, whether it's hospitality, real estate. Everyone wants some kind of help right now so that they don't go under. Manish Sabharwal is saying let's have some patience and see how things develop. Do you think we have that kind of time, Mr. Myra?
Well, firstly, Manish kept saying, let's not prescribe, and you're asking me whether I agree with Manish's prescription. I don't think he's prescribing. But let's take the situation. We've always got to read the situation that we are in and see what is the nature of the action that we have to take now. We would have to take some immediate actions and also be prepared to very swiftly take the right medium-term actions. The immediate actions are, the unfortunate word is social distancing. What we are really saying is physical distancing between people. This is a time for social solidarity. We actually need to reduce social distances while increasing, for our own safety and the society's safety, physical distances between us. So understanding the needs of others who are not as well off as we are will create a solid, better society, more cohesion in society. And in that regard, the condition of those people who are working in what Manish calls the situation in which they are self-exploiting. I mean, it's a horrible term that you have to eat your own flesh to survive. I don't think people are deliberately self-exploiting. The condition of the economy puts them in this condition that they appear to us to be self-exploiting. So we have to change the shape of the economy, the shape of relationships between those who pay and those who need to work to earn decent incomes. And these relationships need not be in large formal organizations. They are in much looser organizations also, the so-called, gig economy as they are is developing in the West, or what has been for decades in India, the so-called informal economy, where the relationships between those who pay and those who work to get pay are very loose, very informal. And the Prime Minister was pointing out to us as citizens our responsibility to take care of those people who come to work for us without any formal contract, without any social security. They have to look after their families too. And if they come out into public spaces or into our homes to work, we will say, oh, you are being irresponsible, you are causing us harm. But isn't the economy, the structure of it, in causing them this great harm, both physical ill health and the danger that they are also in, as well as they are suffering much more the ill health of the economy, the consequences on them. So the Prime Minister today did make, and I was very heartened to hear that he's pointing to the directions. Let's call them strategic prescriptions. He has suggested very strongly that we should be very much strengthening the public health system. He's saying we should be worrying about this informal economy, the people who work in it. They're working hard, they need to work, they need to earn. Can we support them and make sure that they don't do it dangerously? We have to do that. So the development of a social security system has to be the prime thrust of labor reforms in this country. We don't need more flexibility in the labor laws to enable people to be thrown into further insecurity in a precarious informal economy. We need to get the social security system such that people don't rely on their employers to keep paying them, but the public system supports them. That is a good social security system. We need social cohesion.
Yeah,
and if
Mr.
I could just comment, if it's
excellent
okay,
points,
about
but I do have a
the
question,
social
and I'm going to ask
security.
Maithili to come. Yes. Yes, if I may just come back to you, I'll come back to you on the social security system because it's a very crucial one and it actually dovetails into the point I'm making next, and I want Maithili to come into the discussion. In fact, if anyone wants to add to the points being made, please indicate and I will come to you. Maithili, Mr. Myra talks about, and the Prime Minister said that those who can should ensure the wages of the people they hire are not impacted. But the social security system he's talking about is the government's job at the end of the day. And yes, citizens should do right to the extent they can. Everyone needs to come together. But this is one case where the government leads the charge, isn't it? Whether it's direct benefit transfer, whether it's UBI, whether it's any kind of tax breaks, whether it's directing companies to not drop jobs at this point, or whatever it may be, it has to come from the top.
Oh yes, indeed, Tamanna. This has to be the government's, the ball over here is in the government's court. But where does the government finance these things? There is a desperate need for social security in this country, considering that less than 10% of the labour force is in the organised sector. That means a vast majority, overwhelmingly vast majority, does not have any kind of job security at all. So social security is very important. But how does the government finance it? Since the budget is not so long ago, we know exactly where our tax to GDP ratio is. We as a society do not pay our taxes. We know the ridiculously low number of people who declare incomes of over 1 crore in a country where we know there are many times that number who actually do earn more than 1 crore. So ultimately it is some kind of a relationship between the government and the people, where people pay their taxes and then the government does these things like financing social security. It cannot be done overnight. But given the kind of grim situation that we are facing today, and though I agree with Manish that yes, we should not be shooting in the dark, the fact is I don't think we have time to lose. There is a very large section of the society which is extremely vulnerable, which will need income support. So this is not the time for the government to think, okay, we need to think in terms of kind of a social security scheme. You will have to start making these cash payouts immediately, and we have luckily the infrastructure in the form of the Jan Dhan accounts. So forget about the fiscal deficit, forget about public debt right now. Give help to those who need, and it is an overwhelmingly large section of society, particularly if we are keen on social distancing, on the lockdown, which is very necessary to prevent the contagion effect and the community spread of the disease within the larger society.
Okay, I'm just going to get a couple of reactions to this, and Manish Sabharwal, why don't you come in, because it's an important, point of discussion that you started off. At what point should the government come in and act? I think there is no question right now that action will have to be taken sooner, perhaps rather than later. Should it be in the form of direct income support or supporting businesses so that then those benefits can flow down?
I think we don't have enough information to make that call yet. So that's we are resource constraints. I think that in emergencies it is not a medical condition, it's human condition to believe that we need to do whatever it takes. But, and that's what we need to do, and not ensure the health system doesn't have resource constraints. But the notion that the Indian government has the resources to give every Indian a minimum wage income transfer, or every MSME in this country forbearance for loans for 1 year is delusional. We can't do that. We will have to make choices. We will have to make trade-offs. So I don't disagree that we have to do something, but I think that the problem with policy making is they are resource constraints, and you have to live with those resource constraints. So let's just be mindful of that. We don't want the medical system to be resource constrained, but if we gave our minimum wage to every Indian as a direct benefit transfer or universal basic income, we would need 18% of GDP. That would wipe out taxes. So I think we have to be careful with our notion that, forget reality, forget resource constraints. These are just bureaucratic or technocratic or intellectual discussions. People are dying. I'm not undermining the seriousness of the situation, but the notion that the Indian state doesn't have resources constrained is not going to help us find a solution. We're going to have to find trade-offs. We're going to have to find the best way to ensure that the economic cycle gets started as soon as the health crisis is resolved. But there is a sequence here. We resolve the health crisis, we think about the consequences for the economic system, and then we think about the consequences for the financial system. If you start giving bank regulatory forbearance before the virus has spread, then I think that may be the wrong sequencing. But I don't think anybody knows. The only way to be absolutely certain about something is to know everything or nothing about it. And I think in this situation, we must accept that the economy is unmodelable for the next 3 weeks and 3 months. And we just have to be humble, and we need to move quickly, but we also need to know which direction we want to go in, assuming resource constraints.
No. Yeah, fair point, because really we're in uncharted territory. Today, the uppermost thought in every Indian's mind is the fact that they are staring at some kind of, self-confinement. And to what extent that will pan out, that reality also has to sink in before we jump to what happens to wages and jobs. Mr. Myra, you wanted to come in on the point of social security, and let me get you to expand on that. The fact is that there are relatively very few Indians in the formal sector who today can work from home knowing that there will be a salary at the end of the month. There are many more who are staring at uncertainty. Would you have hoped for more clear communication for that vast majority of people?
Yes, this is not something new, that few more people like us are going to be sitting at home worrying about whether they are going to continue to get incomes after 2 or 3 months. The majority of Indians have been living like this for a long time, and presently around us, we don't notice them, have been living like this. A few of us, citizens who care, people like myself, people who lead large unions in this country, people who represent the small scale sector in the country, the women's organizations like Seva, who are a union of women workers in this country, as well as people who worked in senior positions in the government and have retired recently, we have over the last year been getting together informally together to think about what would be the solution to something that we know is there. We know is there. So we did some maths and looked at ideas in our own country as well as ideas from ILO, International Labour Organization, from Thailand, other countries which have been addressing the needs for social security for their citizens while they are not very rich economies, many of them. And we found that it is possible in a sequencing manner, like Manish is saying, the sequence is providing the most critically required assistance to those who need it most critically. And we found what those people are, who those people are, what their needs are, how much it would cost, as well as what need not be given at the moment to people. Maithili has pointed out that when we talk about an economic stimulus, we seem to think first about reducing tax rates for the already very wealthy and on corporations so that they'll invest more. But they are not investing more because there's no demand. There are no incomes for people at the bottom to be able to consume, to buy and consume. So we've got to look at the other end now. How do we enable people to work sufficiently, earn sufficiently, so that they can spend on goods, which will then attract people to invest in producing those goods and selling those goods. Then they'll make profits. Then the question of reduction of taxes on profits. We've got it backwards actually for some time. So let's focus the debate on very much the structure of the economy, and in that, please let's look at the majority of Indians, what they need, how their lives are, and how they can be earning with dignity and sufficiently with security.
Great.
So we've got some ideas, and I think the time has come in the economic debate of this country to shift attention to this.
Yeah. No, great messaging there, and I assure you this is something that a lot of people, including all of us here, care about. It's not just limited to a few. There are a lot of people that care about what is happening to the vast majority of India, and that is where the focus is. Not everyone is living in this elitist bubble, and the focus definitely has to be there. Meanwhile, some breaking news coming in. The United States has approved anti-malarial drug chloroquine for use against coronavirus. This is an announcement US President Trump has made a short while ago. I just want to come to Viren for a quick word, and while we've gotten into the slightly a theoretical sort of discussion of what is going to happen to the economy, I just want to get your take on how you foresee things panning out for the healthcare sector. Because there is no doubt that the healthcare sector is going to be at the forefront of fighting this. People can help by staying at home and hopefully not getting sick, not catching the virus. But those who do will have to land up at hospital doors for treatment. How do you see that panning out?
Yeah. Anything that the normal person on the street can do to make our lives easier, we would much appreciate it. The next few months are going to be extremely challenging, but every doctor that took the oath did it in the spirit of service. We are well prepared in our organization as well as hospitals throughout the country. This is something that none of us ever wished for, none of us anticipated, but this is upon us and we will do whatever it takes. Our appeal is that patients don't, as Prime Minister Modi said, patients don't unnecessarily clog up the system with coughs and colds. We are working with the government towards creating separate COVID hospitals that will be dedicated for treating coronavirus patients, and only those who need ventilators or ECMO machines, who have severe respiratory distress, will end up in the private hospitals.
Again, I've said this before and I must say this again, the group of doctors who are providing consultation services to assuage people's, worries, sometimes on phone, sometimes on WhatsApp, are doing a great service and helping sift out those who might need greater detection or care. I have now with me Mr. Pawan Goenka, Managing Director of Mahindra & Mahindra. Thank you so much, Dr. Goenka, for speaking with us on the India Development Debate this evening on a day when the severity of what we're going to have to do to fight coronavirus has hit, I'm sure, every Indian after the Prime Minister's address. How do you see this impacting the working of large businesses and large business groups such as yours?
Well, clearly, this is perhaps one of the biggest crisis or difficult situation that we have seen. At least I don't remember anything like this in my career. And the corporates, especially large corporates, have a responsibility beyond what they do for their own company, because many of the smaller businesses depend on us, suppliers or dealers. So we are doing as much as can be done in the circumstances. We have implemented many measures, and we are not alone. Most large corporates in India have implemented these measures, and we are watching the situation very carefully every day. We, in fact, have a very senior level rapid action force that we have put in place, which meets every day, virtually meets every day, meaning by phone, not in person, and is monitoring the situation and taking actions as quickly as we can to try and make sure that the impact on people, and that's the primary priority right now, not the business, but more people, is minimized. We have started alternate day or 3 days in a week kind of work from home for those functions that are not essential functions. And in the plants, we are doing a lot of sort of social distancing. We are cornering off areas. We are doing sanitizing. We are doing fumigation. All of these actions that I think most large corporates in India are doing, something that we are also working
on. So what is the kind of impact you see on production? We know sales have anyway been a sore point for the auto industry, but do you see further production cut downs at this point?
This obviously is a very difficult time because the auto industry is transitioning from BS4 to BS6. And that makes it perhaps a little bit more difficult because all the production is new in some sense, and we are learning about the BS6 production requirements. There are still disruption of supplies from China. And also from a few other countries, even though the quantity that the number of parts that we import are not too many, but even one or two parts can stop production. So as it is, the production in auto side is ramping up at a slow pace, and therefore I don't think our local problem will have any impact on auto production because it is in any case slow. Where we perhaps will have a bigger challenge is the tractor side, because for tractor this is the peak season of production, and all the plants are running at full capacity. But even there, we are watching very carefully, and if we have to take any hard decision of setting down production, we will take that. But right now, we are doing all the precautions, like I mentioned earlier, to ensure that we have taken all precautions in terms of sanitization, in terms of cleanliness, in fact, we are taking temperature of everybody coming in the morning. Every person who walks into the plant every morning, we are taking temperature to make sure that we again filter out if there's any danger case anywhere. So far, fortunately, in any of the Mahindra plants or any of the Mahindra offices, we have not had even the smallest level of any scare. And I certainly hope it continues that way, not just for us, but for everybody else.
Dr. Goenka, I ask you this because now that we are looking at extended periods of isolation for everyone apart from certain, people in certain essential services, this is not a business perhaps which can be run from work from home beyond a point. Do you see that as a challenge going ahead? And do you hope for an extension of the BS6 deadline looking at the current situation?
Well, let me say that we are all learning new way of doing business. In a manufacturing industry, work from home is not something that we are used to. And even for white-collar employees who are not in essential services where they have to be physically present, it's not something that it's not routine. In the IT industry, it's very routine, but in manufacturing, it is not. So we are learning. In fact, I have not yet taken a work from home a day off, though we started on Wednesday, but I'll probably do it personally in the next week or so. But I think in some sense, it's a learning process for us. Now, when it coming to plant, and that's where, as you mentioned, is the problem, because that obviously cannot be work from home. As of now, the plant operations have not been slowed down by design. Whatever slowdown has happened because of part supply, not by our action. But if we have to do it, we'll do it. Now coming to BS4, BS6, the problem is not in production of BS4 because BS4 production had stopped for everybody already by end of February or maybe middle of February for some cases. So production is not a problem. The problem is selling, and everybody had timed it so that we will complete all the selling before 31st March. And clearly, right now, nobody is in a mood to buy any cars, and therefore the retail is becoming a problem. We have auto industry has approached the Honorable Supreme Court to at least ensure that the state governments don't stop before 31st March, which was a Supreme Court directive. But the dealer community, FADA, has approached the Honorable Court to extend the deadline because they are the ones who are currently stuck with inventory, which would have been sold in normal situation without any difficulty because everybody was very careful about it. But right now, in a very unusual situation that we have, a force measure, if I could call it, that we have, and the FADA has approached the Honorable Supreme Court, and I hope that the court takes a look at this very unusual and something that is not in anybody's control situation. And clearly, by taking this action of postponing the deadline, no new BS4 vehicles will be made. Whatever is in the pipeline, which would have been finished before end of March, is the only thing that will be sold if the Honorable Court give us some extra time to retail these vehicles.
Dr. Goenka, just one broad question, and I know you have to go, but the Prime Minister has talked about an economic task force. He's also asked big businesses to show consideration, maybe for workers who are not full-time employees, but to ensure that there's no loss of wages. Do you think that that is doable and feasible at this point? And also, if you could respond to what you hope to see coming from the economic task force, especially for the automobile sector.
In the Prime Minister's speech, let me first say that it was a very honest speech. And I think most Indians would be proud of what the PM said today. And he was genuinely trying to, without scaring the citizens of the country, he was trying to ensure that we do our duty, either as an individual or as a company. And his sort of practice Janta Curfew on Sunday is a very good idea because we don't know where it's going to end. And we don't know whether it's going to be something that we will have to do more frequently than just Sunday. So doing it this Sunday is a very good idea to practice. Now, what the PM had said about the large businesses and people with better means to ensure that people who are with more meager means and smaller businesses are taken care of as Big Brother, I think that goes without saying. That has to be done. And I'm glad that PM had specifically requested the big businesses to do it. I'm glad he did that because clearly in a time like this, if somebody is not able to come to work either because of transportation issue or because of having to take care of small children at home, we have to take care of it. We cannot say that therefore you have to take a leave or get a pay cut. In fact, we have given full work from home for all women employees who have children under 13 years of age at home because schools are shut and they have to take care of their children at work at home. We have also given full time off for some category of employees to work from home. So we have done all of those things, and there's no question at a time like this to do any kind of pay cut or wage cut if somebody is not able to come to work. And similarly, like I said, that many small businesses that depend on us, that the biggest problem the small businesses will face is liquidity and cash flow. And many businesses do not have the means to survive if there is not a constant rotation of funds through the revenue that they generate from the supplies that they do. And in time like this, we have to be very careful that we don't let a business get into trouble, small business get into trouble because of this. And we will do that. We have done that. I mean, that is not something first time. In the 2008-9 slowdown, the same thing had happened with a small business, and we have done our part, and we'll do it again. I have no doubt about it. Same thing with dealers. If dealers are not able to generate funds because of liquidity, we have to take care of it. So I think this is something that I cannot imagine any large business in India not playing their part in taking care of their employees in a time like this and taking care of smaller businesses that depend on them for their sort of revenue, for their survival, for their fund flow, which is the biggest problem, the fund flow. We will take care of it. And I'm 100% sure that the large businesses will do their part, no matter who you are.
Absolutely. We all have to do our part at individual level, as a community, as businesses, as Indians in these tough times. Thank you so much, sir, for speaking with us. Pavan Goenka, MD of M&M there on the India development debate, talking about how his group of companies is dealing with this new reality of Janta Curfew. We're going to see the first taste of it really this Sunday, but a lot of preparation, mental preparation for companies, preparation for individuals at par. We'll do a quick check on the US markets before I take a break. An announcement by US President Donald Trump just a short while ago that the US has approved anti-malarial drug chloroquine for use against the coronavirus. Markets, the Dow Jones in the green, flattish at this point, but in the green after that announcement. We'll take a very short break, but when we come back, you will hear some of the biggest market voices in India, Indian market voices, talking about what they see happening in the next few weeks and days. Stay tuned for that. We'll be right back.